At issue here is whether the Food and Drug Administration will approve a drug that is currently being used to treat an ultra-rare disease known as Barth syndrome. It is so rare that the FDA has delayed approval, in part because the sample size is so low. And now the pharmaceutical company that manufactures it is saying that they could go out of business. For one family here in Orland Park, that could spell disaster. In his short life, Adel Mohammed has already been through so much. He was not much more than a month old when he was rushed to the hospital in respiratory distress.
We're just watching them try to intubate him. While they're trying to intubate him, that's when he went to cardiac arrest. And we were just like in shock.
Adel was diagnosed with Barth syndrome, an ultra-rare genetic disease that affects mostly males. There are only about 150 cases diagnosed nationwide. There are currently no FDA-approved drugs for Barth syndrome, but there is one that has been granted what is known as orphan drug status, elimipritide. Adel has been getting daily injections of the drug for a few months now.
Even his pediatrician's like, he's a miracle baby. Like, he's able to lift his head up on his own. He's starting to sit up on his own. He's showing things that you would think he'd be delayed with.
According to the Barth Syndrome Foundation, without treatment, sufferers will exhibit muscle weakness, heart failure, and delayed growth, with most early deaths happening in infancy. But unfortunately, the drug status remains in limbo, as the approval process has dragged on for years now.
We don't know like how long he may live if he doesn't have access to this medication. Like, I'll show you his echoes. Like, he went from 10% back in March to 55% to currently. Like, he's close to normal. Like, this drug does work. It does save lives.
And while a spokesperson for Stealth Biotherapeutics admitted today the company's future is at risk if the FDA doesn't act soon, they also said they're committed to keeping their current patients on the drug for free for as long as they can. Stealth Biotherapeutics did resubmit its new drug application to the FDA just in the last several days, the FDA indicating it may not have a decision for up to 6 months.